Okay, Alicia, abstracting a coding case.
Well, in our Thursday night lectures, webinars, we get together and often take a case. And so this is one that we did, but I decided to do this because we had a question come and says, I need more practice pulling the important information out of a case and where to, get started. So this is actually a case from Practicode, and this is the way more or less that it's set up. You're going to have off to the side in Practicode where you're going to be able to put in your codes. But what I did was, since it's several pages long, and you're not going to get cases on the exam that are several pages, but you may get a page and a half or a full page, and that should not intimidate you because some of that stuff I like to call fodder, and it's not really fodder, but it's information that you don't necessarily need to pull out your the proper codes. So when I'm looking at this case, the things that are going to jump out at me when I'm scanning it first to abstract the information, I put in purple. So why did the person come in for the visit? That's their chief complainer, the CC. They're doing med refill and bilateral back pain. And so in the HPI, the history of the present illness, I noticed right off they have GERD. And then he goes in depth about what's happening with the GERD. And then the next thing, so you've got like almost 3 paragraphs, or it's cut there, on one diagnosis. Then we have back pain. Okay, so that jumps out at me. The person has back pain, and so we're going to find out more information about that. And as we scroll down, we're going to see, I think, I can remember. Okay, that's all that he talks about in the HPI. So right now I know they're going to refill meds, and so we may have diagnoses for that, but he's being, he's having problems with GERD and he's having problems with his back pain. So as we scroll down, we're going to start seeing what type of medications the patient is on, which is going to be a red flag as to other diagnoses that they could have. And I see a few that jump out at me real quick. Carafate is used, for GERD and ulcers and stuff. The levothyroxine is a the thyroid. No, it's not thyroid. That's Synthroid. Anyway, I know what that's used for. And Prilosec also. That's taking care of that GERD. So he's going to get a refill of them. But those right there, with no more extra information, those jump out at me right away. So I scroll down. Let's see. And something else that I always check is the past medical history. Now they did a pretty in-depth social history, but the past medical history, these are things you're going to look for. Make sure that they haven't had an amputation, like a below-the-knee amputation, something like that, that they've had cancer in the past, and this person actually has had cancer. It says cancer, yes. So that tells me, heads up, you might get to code something that may not be talked about in another place on the chart. Don't want to lose that. Also, this person had surgical history of a hernia repair. Surgical history is also going to give you past medical history sometimes, again, if they've had an amputation or for some reason you can throw, you may need a V code. So I'm scrolling down a little bit more. Let's see. Now we have orders. It says the following orders were looked at. We've got Prilosec, Carafate, and the levothyroxine, which again were the ones that jumped out at me, that are probably ones that they're going to be refilled due to what they're being seen for, what they're saying their chief complaint is. I'm going to scroll through these pretty quickly because body systems, when you get to doing your E&M and your leveling, this is going to be important. Right now, while I'm trying to abstract out first the diagnoses, which I like to do diagnoses first because I just like diagnosis coding better than CPT. So that's what I focus on first. And nothing that jumps out at me. You've got to be careful because sometimes they get into copy and pasting in these EMRs, and you do want to watch for that when you're doing your E&M leveling. Okay, scroll down a little bit more and let's see. He doesn't have a hernia that's palpable, so I didn't highlight that, but there's nothing here again that jumps out at me, so I didn't highlight it. And when you're going through this, you might circle it or highlight it yourself. So the assessment in the plan is going to be very important because this tells me exactly what the doctor is treating, what he's doing. So again, those medications, and it's levothyroxine, carafate, and the Prilosec. And then, look, he says, he starts his diagnoses. We have unspecified hypothyroidism. Well, that's why they're taking the levothyroxine. We have reflux esophagitis, which is GERD, and that's the carafate and the Prilosec. And then we have a hernia. It says other hernia of the abdominal cavity without mention of obstruction or gangrene. Very important that it says without mention of obstruction because that changes the code. But we know it's the abdominal cavity, and then after you get a little more familiar with your diagnosis coding and coding of hernias and stuff, the word diaphragmatic is specific. That's the code you need to be able, that's the word you need to be able to find the proper code. Abdominal is not going to get you anywhere. Okay, abdominal hernia, well, that could be anywhere, but diaphragmatic gives you a specific location. So that word jumps out at me. And then, you know, hernia, and then it says malignant neoplasm of the prostate. And I thought, oh, okay, but there was nothing that I saw that jumped out at me except for the history code of cancer. And it says that he's got prostate cancer. It says prostate cancer. But then if you go, I would go back and I'd start looking and saying, well, does he actively have prostate cancer at this time? You know, I didn't see anything where he's had surgery. I didn't see any treatment or medication that they were giving for prostate cancer or the treatment of cancer. So that gives me a heads up, especially when I saw that it was in the history of a section that he had prostate cancer in the past. So we scroll down and let's see what we came up with. So the E&M code, again, you know, 99214, the things you want to know about that. He was very good about the HPI, very specific. Now, if you have your E&M leveling sheet where you can go and click all that stuff off, we don't have that here, but when you're doing that, the things that pop in your head are, you know, how specific was the HPI, how many body systems were affected and did he review, the social history, the family history, all of that stuff, personal history, he brought all of that in there, you know, and then I always think in the back of my head, how sick is this puppy, you know, and you have to meet 2 of the 3 key components for a outpatient visit for a, you know, established patient. And with this 99214, which is a pretty high level, you've got a detailed history, a detailed examination, and medical decision making, a moderate complexity. You have to meet or exceed 2 of those. Okay, and then it goes into about counseling and stuff like that. And he was going to have the patient see his doctor that did the hernia operation in the past to check for this hernia. So your diagnosis codes 553.3 is going to be that diaphragmatic hernia. And again, 553 is a hernia, but it's a diaphragmatic, so that's a 3. The 244.9 is going to be your thyroid, and the 530.81 is GERD, and then the V code, V10.46, is going to be a past history of prostate cancer, and then I've got those listed down lower on the page with their the codes and their definitions. I just happen to have those codes almost memorized because you see them a lot. And again, you don't memorize codes, but codes that you will see repeatedly often are things like the hypothyroidism and the GERD. You'll see those recurring a lot. So they probably will be ones that you tend to learn quickly.
And Tiffany and Kathy shared in the chat that drug levothyroxine is a generic form of Synthroid.
Okay, see, I knew Synthroid. I was thinking, okay, wait, that's Synthroid. No, that is that. Thank you, ladies. I appreciate that.
And let's see. And someone shared reflux esophagitis is 530.11. Where could I go to find common drug treatment for diseases? I notice Alicia mentions that often. You think?
Yeah. I go to drugs.com, and that's the one I started using, but you have to keep in mind that is that's just going to get you in the right direction. But you can go to WebMD has one and some others. I just like the format of drugs.com. Yeah.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.